Hello everybody, my name is Lisa Martinez, and for this presentation I completed a cultural assessment focused on the Yoruba Nigerian culture. I used Ginger and David Heizar's transcultural assessment model to guide the interview and organize the information I learned. Throughout the presentation, I'll talk about the interviewee's cultural background, some of the beliefs and preferences she shared, and how these findings could affect the way I provide nursing care. For this assignment, I interviewed someone whose cultural background is different from my own. She identifies as Yoruba and Nigerian, and during the interview, she shared how family, religion, respect for elders, and communication and traditional values have influenced her experiences and beliefs. One thing I want to point out before I continue is that these are her personal experience. I am not trying to say that every Yoruban patient will think or behave the same way. The purpose of this interview was really to understand how culture can affect healthcare and how nurses can use that information to provide more individual care. Yoruba Nigerian culture. Before getting into the interview, I want to give a little background on the Yoruba culture. The Yoruba culture are primarily associated with southwestern Nigeria. Nigeria itself is located in West Africa and culturally and linguistically very diverse. English is the official language, but Yoruba is also widely used within families and communities. Religion can also vary. Yoruba individuals may practice Christianity, Islam, traditional Yoruba beliefs, or a combination of beliefs. What stood out to me from the interview was how strongly she connects with her culture, family, community, respect for elders, and religion. These values became a theme throughout the rest of the interview. Ginger and David Heizar's model. To organize the interview, I used Ginger and David Heizar's transcultural assessment model. The model looks at 6 different areas: communication, space, time, social organization, environmental control, and biological variations. I found the model helpful because it gave me specific areas to ask about instead of just asking someone to explain their culture in a very general way. It also made me think about things I might not normally ask patients about, like comfort with touch, time orientation, family decision-making, or traditional healthcare practices. Communication. Communication was one of the most interesting parts of the interview. She speaks both English and Yoruba, but she prefers English when discussing healthcare because that is what she is most used to in terms of medical settings. She said Yoruba feels more natural when she's speaking with family or other people from the same cultural background. She also explained that respect is very important, especially when communicating with the elders. Tone of voice, body language, and even eye contact can affect how conversation is perceived. One thing that stands out to me was her explanation that some people may not immediately question a healthcare provider because the providers can be viewed as authority figures. This is important for nursing because a quiet patient may still have many questions, or they might not fully understand. So instead of asking only, do you understand, I would want to encourage the patient to use a teach back to make sure communication is clear. Space and time. When we talk about personal space and touch, she said that she understands physical contact is sometimes necessary in healthcare. What matters is that the provider explains what they're going to do first. She also explained how privacy and modesty are important during examinations. That may include keeping the patient covered as much as possible or asking whether the patient has a preference for the same gender and providing that personal care. We also discussed time. She describes Yoruba culture as being influenced by the past, present, and future. For example, family history can influence how someone thinks about their own health, while current health choices may be made to prevent future problems. She also mentioned that while Nigerian culture may sometimes be more flexible with time, she personally places a lot of importance on being punctual for healthcare appointments. Social organization. Family was probably one of the strongest themes in the interview. She explains that a health problem may not always be viewed as something affecting only one person. Family members become involved, providing emotional support, transportation, financial help, and assistance with decisions. She also said that elders can have an important voice in major family decisions. At the same time, she made it clear that this can vary from one family to another. Religion and spirituality are also important for some Yoruba families. She describes prayer as something that can be used along with medical care rather than just prayer itself. For some patients, faith can be a major source of strength, comfort, and hope during illness. Environmental control. The interview also included traditional approaches to healthcare and healing. She talked about practices such as herbs, teas, special foods, home remedies, and prayer. What I found interesting is that she did not describe these practices as replacing medical treatment. Instead, she was comfortable using certain traditional practices together with Western medicine as long as they're safe. She also explains that some people may understand illness through medical causes, while others also consider spiritual explanations. For nursing, I think that this is where being non-judgmental is important. If a patient is using herbs, supplement, home remedy, spiritual practice, it is better to ask about it openly so we can identify any safety concerns instead of making a patient feel judged or dismissed. Biological variations. When we discuss biological variations, so she brought up conditions such as hypertension, diabetes, as health concerns that may be seen in Nigerian or Yoruban communities. However, she emphasizes that nurses should not assume a patient has a certain risk just because of their ethnicity. Family history and individual patients still needs to be assessed. Diet was another important topic. She describes foods such as rice, beans, yams, plantains, soups, vegetables, meat, cassava, and fish as common foods with Yoruba culture. Some meals may be higher in salt, oil, carbohydrates, depending on how they're prepared. For me, the nursing takeaway is that nutrition education should not be about telling someone to completely stop eating foods they grew up with. It should focus more on realistic changes, portion sizes, healthier preparation methods, and still respect the patient's culture. Nursing care delivery. After completing the interview, I identified 3 changes I could apply to nursing care. The first is communication. I would make more of an effort to use a calm and respectful approach, encourage questions, confirm understanding instead of assuming the patient understands because they are just quiet. Second is privacy and personal space. I would explain that I am doing what I am doing before I touch the patient. Ask permission and protect their modesty as much as possible. Third is asking about family involvement and traditional practices. Instead of assuming who should be involved, I should ask the patient who they want to be included in their care. I would ask about the herbs, supplements, prayer, home remedies, so those practices can be considered safely as a part of their plan of care. Reflection and conclusion. This interview made me think more about how many different parts of healthcare can be influenced by culture. It's just not the language. Culture can affect how someone communicates, who they trust, who they're comfortable with, asking questions, who they want involved in their decisions, what foods they eat, and how they understand the illness and the healing process. The biggest thing I learned is that cultural congruent care is not just about trying to memorize a list of characteristics for every culture. It's more about asking respectful questions and allowing the patient to tell you what matters to them. Going forward in my nursing practice, I want to be more intentional about asking those questions instead of waiting for cultural needs to become obvious. I think that we can help to build trust and make these patients more respected feel more respected and involved in their care. This is my reference list. Thank you for listening.